Do you feel a slight pain in your groin, hip, or outer thigh area? Maybe even around the glutes? Well, keep watching, because I may explain why this could be. Hi, I'm Jason, Associate Osteopath at Worthing Osteopathic Wellbeing Clinic. Does this hip pain progressively get worse from standing or walking, especially after long periods of time? Or maybe you find the hip pain gets worse after long rests. Whatever the reason, have you ever considered that it may be due to arthritis? Although we can't diagnose arthritis for you, this would need to be done with imaging. We can do lots to help with the easing of the pain and helping you live your life to the fullest. In this video, I'm going to explain how we can help with arthritis using hands-on treatment, but as well using laser class 4 therapy. Here's the problem. You love to go on long walks with your friends, and you do this most days, but recently you found yourself to be limping and a little bit sore in the hip area. After you walked, you tend to do some stretching and think nothing of it. As time goes by, limping gradually gets worse to the point where you have to give up on your long walks. You keep stretching, thinking that it's just a pulled muscle, but the pain doesn't go away. It just gradually gets worse. Now you're experiencing hip stiffness as well. You start to get downhearted as you've had to give up your walks. You're annoyed as it affects the basic tasks that you do in your life. You're finding you're getting very irritable towards your friends and family. You've been to doctors and got it diagnosed as osteoarthritis, which is a weight off your mind as you now know what is causing the actual pain, but you're left wondering if you're going to be able to do these long walks again, or if they're just a thing of the past. Well, I'm here to tell you it's not, and there's absolutely something you can do. Keep watching as I'm going to explain to you how our hands-on treatment can essentially ease the pain and help you get back to those long walks and achieving the goals. As well, something that can have a major impact is laser therapy. Osteoarthritis is one of the most common conditions we help with in our clinic. It's basically a wearing of the joints in the body and mainly affects joints of the neck, hips, knees, and back. Today though, I'm going to focus on the hip. So what is involved in osteopathic treatment of the hip? Firstly, we use manipulation, articulation, as well as soft tissue techniques to move and stretch the affected joint. By doing this, we are helping to ease the pain, making it more comfortable for you. You may also work on other joints and muscles surrounding the area, as this will help the body to function as a whole. As an osteopath, we like to take a more holistic approach to treatment, so not only will we be treating the arthritic area, but we'll as well be looking at home, life, exercise, diet, posture, and what your goals are from having the treatment. We feel it necessary that we do this. So what's involved in an osteopathic treatment of the hip? Firstly, we use manipulation, articulation, and soft tissue techniques to move and stretch the affected joint. By doing this, we're helping to ease some of that pain, making it more comfortable for you. We may also work on other joints and muscles in surrounding areas in order to help the body to function as a whole. As an osteopath, we like to take more of a holistic approach to the treatment, so not only will we be treating the arthritic area, but we'll be as well looking at different things like your home life, exercise, diet, posture, and what your goals are from having the treatment with myself. If we feel necessary, we will refer you to a doctor for further investigation though. In addition to our hands-on approach, we recently invested in a class 4K laser. We have found that laser therapy is very effective for people with arthritis. Laser therapy has been shown to not only speed up recovery of damaged tissues, but to increase the amount of collagen production, which means the repaired tissue is stronger. There is also a vast amount of evidence to support laser therapy, and it has been shown to help conditions like osteoarthritis. Not that it can reverse this condition, but it can help to significantly reduce the pain. All lasers work on a wavelength of light that is on the safe side of the visual spectrum. That is, they are on the non-ionizing side, whereas X-rays and gamma rays are on the other side, so ionizing, which is more damaging if you're exposed over period of time. It uses selective wavelengths of light to stimulate key molecules in human tissue. Decades of medical research has identified the wavelengths, energy levels, and frequencies that induce the changes in the cellular metabolism, a process called photobiostimulation. So what's special about a laser therapy? Well, it works on 4 different wavelengths. This determines how deep the laser can penetrate the tissues of our body. The other thing that it can affect how deep the laser works is the output of the power. Therefore, sometimes the laser can be a continuous beam, and other times it can be a pulse beam. or even a super pulse beam, which basically means flashing. Also means that we can turn the power up without overheating the tissues and go to deeper depths. Not only does the laser treatment help with pain and inflammation, but it also helps with the tissue recovery and significantly speeds up the healing time. If you're suffering from arthritis and would like more information on laser therapy, then comment laser down below and one of the team will get back to you. Thanks for watching, everybody.